Hi, I'm Sharad, consultant psychologist and psychotherapist, Futureace Hospital, Edappally. This is Dr. Femi, consultant psychiatrist, Futureace Hospital, Edappally. So, October 10th, World Mental Health Day. This year's Mental Health Day theme is making mental health and well-being a global priority for all. So, in your perspective, what is the significance of this theme, ma'am?
According to the WHO reports released this year, there has been an alarming increase in the depression and anxiety rates, more than 25% from previous years. So this increase has added to the global burden of disorders. Like if you look at the reports, depression ranks second in disorders leading to morbidity, and anxiety ranks sixth. So when such diseases go under-treated or under-identified, they contribute to a lot of losses in global finances as well as health and people's well-being. Okay, and moreover, if you look at our country, India, previously where there were 381 people committing suicides per day, it has sadly risen to an alarming number of 418 now. So, and all this is going unaddressed. So we have to look at it from our country as well as from a global perspective, how we can address these issues and reduce the rates.
Okay, ma'am. So, in our community, even though mental health is stated as a priority on papers, till now it is not being delivered in an efficient manner. So, what can be done to include mental health as a priority in our community from a community level?
From a community level, I think people have to be made more aware that mental health issues are not just cases where people are very violent and they are creating a ruckus around, but also when people are silent and they are suffering alone inside. That is also a mental health issue that has to be addressed. When kids are having difficulty writing exams or performing on stage properly, that is also things that can be addressed with the help of a psychologist. All these things has to be informed to people at a very grassroots level if they want, or they should be knowing that they can come and seek help for these things. So that is the first step, making awareness. Second, and very importantly in our community, is to break the stigma about mental health illnesses. What most people think is, you go to a psychiatrist for any small ailment also. You would directly be prescribed medications with probably side effects worse than chemo drugs. I don't know what people think about our medicines, but that is not true. We have medicines that can very effectively as well as with rather very little side effects treat these problems, and they can lead a very content life, and productive one.
Okay, ma'am. So then another thing that we all hear about is integrated mental health. So what is integrated mental health, ma'am?
See, integrated mental health is an ideal scenario where everybody works towards, it is people work as a team to address a patient's every aspect. Like there's a psychiatrist, there's a psychologist, there are social workers, everybody together works towards the betterment of that person's mental well-being.
Add inclusivity. What other factors can be included in the concept of integrated mental health?
To make any idea which is new, inclusive, and for people to accept, it is more accepted when people who you look up to, like film stars or sports persons or famous people, they come forward and talk about it. It even helps when doctors or professionals also talk about it. So that is when you begin to accept, okay, it is okay to go seek help, and there are people who have sought and have gotten better and are doing well. It's just like before going for a surgery, you ask, you do a background check, ask, surgery, if you do the surgery, is it okay? People get better after it, or how is the complications? You ask someone who's already done that surgery or gone to the same surgeon. So same way, speaking about our mental health issues really help, other people to come forward. We might go to a house and say, I have sugar, don't add sugar in my tea because I have diabetes. But you never go and say, I'm someone who's afraid of heights, please, I'm taking treatment for the same. nobody speaks about it. So I think we should all start speaking about mental health and make others aware about it.
So we stand together to promote integrated mental health
And to break the stigma against mental health.